Okay, so welcome to today's COP virtual poster session. We're thrilled to have this as one of our virtual events this week as Source recognizes our annual celebration of National Volunteer Week. So this really kicks off a few things that we're doing virtually this year in the context of COVID-19. We are really thrilled that you all have taken the time to put together your beautiful virtual posters. I certainly want to thank all of our Center for Community Innovation and Scholarship team members who have helped alongside of Source with COP all throughout the year. So Brenda Small, who some of you knew by email or maybe met in person, actually recently retired. So we certainly want to thank Brenda for all of her work throughout the years. Of course, Dr. Sharps and the rest of the team, including Katie Nelson and the wonderful Emily Vo that you all already know. As well as Kimberly Hill and a few others that have been essential to making sure COP ran smoothly this year. So how's this going to work today? First, I would like to introduce our three judges for today. Dr. Phyllis Sharps is one of our judges, and she's on screen there if you want to give a quick wave, Phyllis. Then we have Megan Barrett, who most of you probably already know, who's the Director of Student Affairs, School of Nursing. Hey, Megan. And then Ezat Shahade, who is our Communications Specialist over at Source. Hi, Ezat. So here's how this is going to work. I'm going to have everybody please stay on mute until it is your turn to do your poster. I'm going to share my screen momentarily, and we're going to kind of go in order of the slide deck. When it is your group's turn to present, please unmute yourselves so you can speak through your slides. We're going to allow about 4 minutes per poster as a maximum, and then we're going to allow one judge question. Whoever of the judges feels like unmuting and asking a question to get further clarification, but I'll also be keeping track of the time there. I have a few of our other colleagues that have joined us also from the Center for Community Innovations and Scholarship, as well as Source. I'm pointing out my friend Tony Bridges, who is one of our assistant directors. And Tony's just making sure that we don't have any Zoom bombing going on today, which I don't anticipate because this is all a password protected session and only given out to folks that have RSVP'd, which includes our COP folks, as well as I see that we have a few preceptors from our nonprofit organizations that we work with. So we're thrilled to have you all here as well. So let me get started with sharing my screen. Share to get us into our wonderful slides. Our judges also have a scoring sheet. They're going to have an opportunity to turn in their scores on your presentations to us. We are not going to announce any winners today live in the session, but we'll let everybody know afterwards who had, like, you know, the best scores for having wonderful COP poster presentation today. So we are going to start. We're actually having the Wald team start first. So that is Caitlin and Karen. And you two can unmute and tell us about, and just tell me when you want me to move the slide deck forward.
Thank you. Yeah, so Karen and I were at Wald Community Nursing Center and Outreach with Dr. Ling, who's on the Zoom, and Alexis Pei, who maybe you can see in the corner of this photo right here. She's running Wellness Boot Camp there, as well as Miss Kim Hill. Dr. Sharps was involved, Janae Bryant, Sherry Chen. Our student learning outcomes were appreciation for the strengths and needs of the East Baltimore community, familiarity with available community resources, competence in constructing health education materials, and experience in community outreach and in-person health education. Yeah, and you can go ahead and switch the slide.
So for some of our on-site services, we have TB testing. That's a big thing we do there. Glucose readings and a lot of healthcare navigation. A lot of people that come in for the TB test kind of want some other resources, so we're good at connecting them with other resources and education. One of the big things that we do as students there is Day at the Market. That's every other Wednesday at the Northeast Market. We do community outreach there. Every other week we have a different topic. I know for Thanksgiving we did like healthy and affordable, low cholesterol, low sodium foods. And then we also do blood pressure screenings every time there. And we have these little cards that we can give out because some people kind of rely on having their blood pressure readings on us and going every 2 weeks to see how they're managing their blood pressure. Another thing that we do is the wellness boot camp. And it was just started a couple months ago, a very popular program for the faculty and staff of the Hopkins network. And every week participants work out with a Wald trainer during lunch hour, and they keep track of their fitness goals. They build a community and enjoy a little healthy competition, which is actually the picture we saw previously with Alexis, where they were doing yoga, but they do pretty more intense stuff. Mm-hmm.
Yeah, I was very sore after doing wellness boot camp. So another thing that we do, which I actually know a little bit less about, but I think it's really cool, is the Israel Baptist Church partnership, which is also a new program. And what's cool about it to me is that it's very community driven. So Wald sends some nurses there. And they do sort of, I think it's mostly been centered around mental health sessions with the church, so they can get kind of like a religious perspective and a medical perspective on wellness, which I think is really cool because the community basically talks about what they need and what they want. Let me see if I can move this. And then recently, Wald has also been working together with House of Ruth and Henderson Hopkins, and I think some other organizations have been on those Zooms as well, but those are the ones that I recognize. And they've been transitioning to telephone services, and they're doing their Ask a Nurse program, which we actually didn't put on the slide, and we should have. It's a huge part of what Wald does. Ask a Nurse, where people can come in and ask whatever questions they have with licensed nurses. They're doing that over telephone right now, and they're releasing a lot of resources both over the telephone, and they're releasing them with Henderson Hopkins, just trying to get some mental health resources out there, as well as any other resources that people might need to be connected with, basically helping with healthcare navigation in this time when everything feels really disconnected and kind of hard to figure out. Yeah. So that is Wald. I don't know if we're doing questions or not.
Yeah, we have about a minute for questions. So if any of our three judges wants to ask any additional questions, please unmute and chime on in.
I just had one quick question, Caitlin and Karen. Is there any talk of extending the wellness boot camp to community members, or is that just for School of Nursing staff and faculty?
I haven't heard any talk of extending it to community members. That would be very much in the spirit of Wald to want to do that. And I know they've been talking about some different ideas for doing wellness kind of fairs in different places, kind of like outside of the office, which is on Broadway. But I haven't heard any talk about opening it to the community. Probably Dr. Ling would know, but they are talking about continuing it next year again with faculty and staff, which I think is pretty cool.
Great. Thank you all so much. Appreciate
you.
your presentation.
Thank you.
Okay, so next we're going to turn it over to Brooke and Sydney, who have been at Commodore John Rodgers, and I know Hannah was on here, their preceptor. So Brooke, are they here? Sydney?
Yes.
I can't
Okay,
see
so
everybody. I only see four because I've got my screen shared. So
so Brooke and I worked at Commodore John Rodgers Elementary and Middle School. Our roles were we basically served as health educators for pre-K and kindergarten students, and we taught once a week about various health-related topics. So it was a lot of fun. But our goals were make learning about health fun and interactive, create relationships with the students and the teachers, educate the students about the importance of health and self-care, and teach students about the role of nurses and how they can become a nurse one day too. We're actually still working with the students. We've managed to kind of adapt during these COVID times, and Brooke and I have been doing online recordings for the students through Zoom. And then Hannah, our preceptor, has been helping and uploading them to their Google Classroom so they can still see our voice. But yeah, and Brooke can tell you a little bit about some of the lessons that we did.
Yeah, so like Sydney said, we did a variety of health lessons. So we did one on germs where I gave the kids glitter and they shook each other's hands and they saw kind of how fast germs spread. And we worked on hand washing. We also did exercise, so ways that they can exercise, playing outside, doing sports. We taught nutrition where we did a My Plate activity where they could match certain foods onto different portions of the plate. And then in the right-hand corner, I don't know if people can see it. Well, maybe if you move the cameras, but we had them draw as a class different things that you need for a bath. So they drew, the bathtub, water, soaps, sponge, all of that. And then we did relaxation, so ways that they can just sit and breathe and calm down. I know that they really liked that. So we did, imagining that you're a puffer fish and you're breathing like a puffer fish. So we found some good videos for that. And then we did visiting the doctor, nurse. We made these little checkup lists where they partnered up and one played the nurse and one played the patient. So they went through and did like a mini assessment, like, what color are their eyes? Like, do they have 5-10 fingers and like stuff like that. So yeah, it was really fun. And then like Sydney said, we have transitioned over to virtual lessons. So we just did a lesson on brushing your teeth and we did a video presentation for that. So, which we'll probably be doing another one this week and then for our last week as well. So yeah, it's been really fun. We've found that like the more
1 minute.
active it is, the better.
Great. Okay, judges, any questions?
I don't have any questions. I just want to say this is a really a terrific slide and terrific project. Yeah, this is great to hear. Thanks so much.
We should show you some of their other resources that have been made. I've already commented on their one. Okay. All right. So thank you all, Sydney and Brooke. All right. Next, we are going to move on to Jessalee, who's been working at Dayspring Programs.
Hi, I've been working at Dayspring Programs. So Dayspring is a nonprofit organization which provides housing and Head Start services in the East Baltimore area. So the housing program serves homeless families with an addicted parent and has 3 components. So the transitional residential treatment program, and we have about 18 families right now, but that's always changing because families are coming in and out. Permanent supportive housing using the Housing First model, and an outpatient treatment program. So the main focus of what I did was centered around making a community health fair. So it was called the Dayspring Opioid Prevention Exposition, dope, health fair, and the focus was about the opioid epidemic in East Baltimore. And we wanted to focus the community health fair in alignment with the goals of the Baltimore City Opioid Addiction and Overdose Response Strategy. So this strategy has a three-pronged approach, which has to do with saving lives via Narcan distribution training, expanding access to substance use disorder, and education. So a large part of what we did was we contacted different community partners in the area. So this included Marion House, the police department, fire departments, local churches, and the Baltimore Harm Reduction Coalition. So we partnered with them to come in as vendors for community health fair and give out leaflets, brochures, and educate the community members who we're inviting. And everything else we did around the health fair had to do with like planning, contacting food donors who would come in, and like making flyers and getting the event. Currently, it's going to be postponed to fall because of COVID-19, but we're hoping to pick this back up. And the other thing that I had, the other focus that I had was creating Friday Fun Nights. So Friday Fun Nights were social nights with all the families in Dayspring. So we come together on Fridays and we have social events with pizza, and I would prepare different events. So Some events we had lined up were like painting activities, tie-dye t-shirts, UV bracelets. So some of them had a science component, others were purely for social or for holidays. And it was mainly just after a week of a long, hard week to get families and get their kids together to socialize with each other and have that community engagement. Yeah, so those were my two focuses with COP.
Great, thanks, Jessalee. Any of the judges have a question for Jessalee? Okay, let us move on. Thanks, Jessalee. Okay, so next is our team that's been with Gilchrist Hospice, so Sasha, Leah, and Molly.
Hi, so yeah, we worked at Gilchrist this semester, and I'm just going to kind of let Sasha go into the background and history of the Joseph Ritchie House.
Yeah, I just find it fascinating. This is actually, Joseph Ritchie was created as a hospice, a freestanding hospice in 1887 by the church that it's next door to and a group of sisters, nuns. I think they're called, the All Saints Sisters. So it started in 1987, right around the time of the HIV/AIDS epidemic began, and it was I think the first and only hospice that was taking these patients at the end of their lives at that time. So the whole focus of Joseph Ritchie House, and now Gilchrist since 2014, has been kind of serving the people who nobody else is reaching out to as they're dying. So that's sort of the type of place it is.
And Gilchrist is a really special place. They have their own Gilchrist centers where residents can stay, but they also do outreach into other residential facilities that are owned by like Future Care or something like that. They provide hospice services to those patients there. So Leah and Sasha worked at the Gilchrist like specific Joseph Ritchie House location, and then I kind of did more of the third party like nursing facilities. And basically our job was to be companions to residents that we were assigned to, or just help around with whatever the facility needed. And so probably one of the biggest things that we learned was that hospice makes a significant difference in people's quality of life, even though they're at the end of their life and the quality of their life may not be good at that point in time. And one thing that we really learned throughout this is that when you're visiting your patient from week to week, things are going to change. Like, just because they had a bad day when you see them today doesn't mean that they're going to be even worse next week. Like, they might rally a little bit, they may be worse off, they may be the same. Like, you never know what to expect, and you just have to go in and meet them where they're at and just be that support for them. And through this, we learned that death doesn't need to be scary, and that it is important to have people that surround you when you're at the end of your life, and also surrounding like family members who are there with their loved one. And actually, in case anyone didn't know, Medicare law defines that hospice care in America needs to have volunteers in order to run. So that kind of makes us, I don't know, I guess required to help out like at Gilchrist, because they do need the volunteers. So next slide is kind of just shows what some of the things that we did.
1 minute.
Yeah, so just like making Valentine's Day cards and kind of going back to like, you never know like what your residents are going to be doing or how they're going to be that day. And so, you know, you may be really excited to give them this card and they're not having a good day, or they may be asleep, so you just leave it, or you walk in and like just their family's there, and so you give the card to their family. So yeah, just not really like knowing what to expect, but doing these things for them anyway. So picking up library books that they may want, even if they're not going to read it, listening to them, talking to them, most importantly, like smiling and like being a face of joy for them, singing, clapping, holding hands, that type of thing.
Great. Thank you all. Judges, do you have any questions of Molly or Sasha at Gilchrist?
I was just going to ask, was this your first experience in that kind of a setting? Was this some kind of new and something that you could see maybe shaping your career as a nurse?
I can say for myself, one of the selfish reasons for doing this project was that I wanted to see if it was interesting for me. I'd worked with the elderly before, but not in this sort of legally defined window of hospice. So yes, I'm interested. So, and it was the first time working in a hospice.
It's great.
Great.
Thank
Thank
you.
you all so much for your presentation. Okay, so next up we have Katie and Amelia, who've been working at the Hampstead Hill Academy on the Food for Life program. And I know your preceptor, Ariel, is also on the call.
Hello, everyone. Yes, we've been working at Hampstead Hill Academy in the Food for Life program, teaching kids about nutrition and how it can be fun, and eating new foods and trying new foods can also be fun. So here on the screen is just some pictures of the class, of some students in the classroom making fun things and trying new fun things with food. Next slide, please. So Food for Life is as you can see on the slide, an experiential food and nutrition education program at Hampstead Hill, which is a pre-K through 8th grade public charter school, which teaches students about healthy eating habits and exposes them to new foods in several ways. So we were able to be involved with Food for Life in several different aspects, which Amelia will discuss.
Yeah, so I'll be talking about the class and the community dinner aspect, and I'll let Katie get to the rest. Kind of as Katie said, the class is one of the resource classes at Hampstead Hill Academy, so they rotate this class with other classes like nature. They start as kindergartners, and when they're young, it's very basic, kind of introducing them to new foods and My Plate. And then as they get older and move through the program, they start to learn about how to read nutrition labels and more about the actual cooking part. And eventually they get to the point where they're cooking entire recipes, you know, with their classmates, which is awesome. And then as far as the community dinners go, that's also a really cool aspect about Food for Life. Food for Life and the Culinary Arts Club play a large role in their community dinners, and those occur 4 times a year. And it's really just a chance for students and parents to get together over a fresh cooked, healthy, seasonal meal. The Culinary Arts Club students help design the menu, cook, and serve dinner to a couple hundred individuals. And so this spring, it was combined with International Night, which showcased several different cultures, dance and music, such as Greek, Chinese, and African dance. And so the audience was able to enjoy international foods while learning about their community's various cultures.
So Community Arts Night, or Community Arts Club, Culinary Arts Club, and the School Garden are 2 things that are after-school programs that Ariel Demas, our preceptor, leads. Let's see, they rotate. So twice a year, they switch off between Culinary Arts Club and Garden Club. And so these are after-school activities that the kids can participate in. In the corner of the screen, you can see that there's some gingerbread houses. That's a big event that the kids like to do for Culinary Arts Club every year. And then off to the right side, there's the school garden, which the Garden Club participates in and maintains. And they actually use the produce that is made in the school garden to cook with in the Food for Life class and for the community dinners.
1 minute.
So the big thing that we got to learn about was in the school garden was planting daffodils, which was a lot of fun.
Mm-hmm. Next slide, please. So I'll try to keep this brief because I know we're short on time. So what we learned, I'll let Katie talk about Don't Yuck My Yum. We learned that a lot of children really do enjoy learning about nutrition. For a lot of them, it's a release and a good break from math and science, and they're learning hands-on skills. In a more overarching note, the classroom environment's really critical to a child's success, and part of what makes Ms. Demas a great teacher is her ability to take each child's unique situation and keep that in mind when she's working with them. And then just, I'll say this generally, I don't really have time to expand, but the effects of Food for Life reach far beyond the student, which is awesome.
So Don't Yuck My Yum is kind of a key phrase that Ms. Demas gives to the children, just to kind of generalize, saying, you know, trying new foods, students can be kind of like, ew, this is gross, and make weird comments, but Don't Yuck My Yum is just to say, like, some people like it and some people don't. So, but don't say your yuck is to my yum. So I think that's just in general principle that we can say, like, just to be, trying different foods, trying different things is great, and it's not for everyone. So, but just to value everybody's opinions.
Great, thank you. I'm going to stop you there because we're out of time. Thank you so much. Judges, any questions that you have for Amelia and Katie?
I just had a quick one. Are all the cooking facilities right at the school?
Yes. So there's there's one stove, an oven, and a big table that the kids use, and they have all the cooking stuff right in the room.
Great, thanks.
Thank you. Great job. Okay, so next we have our Henderson Hopkins School. See if Robbie is on the call.
Hi.
Yeah, very good.
Okay. Yeah, so I was at Henderson Hopkins this year. Henderson Hopkins is a Johns Hopkins partnership school. It serves grades K through 8, and it serves the students who live in the community nearby. So I worked in the health suite with Marcella, who's a DNP student. So she did most of the programming, and I helped with her. With the help of Dr. Francis was our faculty who helped with advising. And the two main things we did were professional development and then puberty education. So with the professional development, we did monthly educational programs or activities that we presented to the staff on their professional development days. Some of the examples we did was a water challenge where we challenged teachers to track how much water they drank during the day and over the month, and then we were going to give prizes to the winners. We did a healthy holiday eating challenge, so just educating staff on how to make healthy switches during the holidays when it can be a time where you consume more calories than you would want. Another one was a walking challenge, which was similar to the water challenge. And then with the puberty education, we did small groups of 3 to 4 fifth grade girls. And it was a curriculum based on the always changing puberty education, just helping them understand. They don't have puberty built into their health education curriculum. So it was something that we sent permission slips out to the families, and the parents would have to sign the kid up for the program. But that was a great experience, just working in small groups with the kids and helping educate them on puberty and answering their questions was fun, and they were just interesting to work with. So that was the two things we did the most. Some takeaways was that one of the difficulties was just with planning events, working with teachers and school staff to get the activities we want done, with the puberty classes. They went on during lunch, but sometimes it was hard to get the kids to get permission from teachers to have the girls leave their classroom because say the class got detention or something. And then also, the importance of health education at a young age. One thing I thought wasn't not having puberty built into their curriculum, I thought was interesting, and how important it is that some kids' parents may not talk to them about puberty, so it's important that they learn it somewhere. One limitation was that since it was me and Marcella, we only did a female. We only worked with girls, and in the future, hopefully, if there was a male educator who would want to work with
1 minute.
Yeah, that's it.
Great, thank you. Judges, any questions? Okay, thank you so much for your work at Henderson Hopkins. Okay, next up, we have Ellie, Carla, and Jenna, who are all working at the Harriet Lane Clinic as part of the HIV counseling and testing program.
Hi. Yes, we were all at the Harriet Lane Clinic. So I'm just going to start out with a little history of the Harriet Lane Clinic. It's been around for about a century, working along with Hopkins on pediatric research, medicine, and training. Before it used to be called the Harriet Lane Home, and it was the first hospital in the nation devoted to children, and now it goes by the Harriet Lane Clinic. It is currently an outpatient center that provides care to about 8,500 infants, children, adolescents, and family in the East Baltimore community. And its main mission is to improve health and the quality of life for these children and adolescents within families. The clinic is led by a multidisciplinary team, so it has a wide range of services, as you can see on this slide. These include acute illness care, adolescent services, family planning, gender consultant care, social work, mental health counseling, nutrition, and parenting support. And it also has a wide range of programs, which were more of what we were involved in, including STI and HIV prevention, the PrEP program and sexual health risk reduction team, and also reproductive health services that are provided through Title X. And Jenna will be talking a little bit more of what we did day to day. And you can go to the next slide for this. Thank you. So yeah, so a day in the life, basically. We always worked 1 4-hour shift a week, and this usually began with determining which of the incoming patients would be eligible for testing, for HIV testing that day. The criteria often included being between 13 and 24 years old, having a history of sexual activity, and potentially having other risk factors. Throughout the shift, we also worked with providers to determine which of these patients needed and wanted testing that day. So this might have been impacted by the reason they were in the clinic or the length of their appointment. So basically not every person that we said was eligible would actually get tested that day. But if they were going to get tested, that involved gaining consent, teaching the patient to swab their mouth with a rapid oral swab. So you can see that image on the right. It was just a really simple swab. You just like put it around their whole mouth, like between the their gums and their cheek. And then this test would run for 15 minutes, and then we provide the results to the patient. While the test ran, we often counseled patients on sexual health and risk reduction, and this often included discussing contraceptive methods, STI prevention, and PrEP, as well as we provided them access to the condom closet, which is shown in the image on the left. It had lots of different condoms, and just a way to kind of make sure that we had really good access to easy ways to prevent STIs. And then we often then entered the patient data and updated the provider.
Thanks, Jenna. So our impact overall, just to help ease strain on the program itself, but I like to think that we also just had an impact on individual adolescents. We provided a lot of one-on-one care, especially in terms of sexual health counseling that we provided. So our student outcomes, we, like I said, directly engaged with the community's youth. We were able to identify community challenges and barriers to care. For example, challenges faced were like teen pregnancy, high rates of STD, HIV, substance abuse, crime, stuff like that. We also learned how to mindfully educate patients on HIV and sexual health. We got very comfortable talking about sex with kids, in the hopes that normalization of conversations like that will help reduce rates of STDs, just by teaching them how to, conversate about safe sex practices. So we also just learned how to test for HIV, and we built a meaningful partnership with HLC in general.
Great. Thank you all so much. That was great. Any of our judges have any questions for Ellie, Carlin, Jenna?
This is Phyllis Sharps. What did you find was the biggest challenge in terms of talking to adolescents about sexual issues?
I would say that honestly, most of my conversations went really well. I was very surprised by how often patients were like just super willing to talk about everything. Like we often asked, relatively invasive questions, I would say, about their sexual history. So I know that doesn't totally answer your question, but like I didn't find it as challenging to get just kind of like understand like a greater amount of their sexual history as I had expected.
Great. Thank you all so much. Okay, moving on. Heather was at the Johns Hopkins Hospital Emergency Department also doing HIV counseling and testing. Heather.
Hi. So at the Johns Hopkins Emergency Department, they've had this HIV testing in the emergency department since around 2005. And so basically it was one of the pioneers in e-base because they found that doing the testing in the emergency department when people are there kind of trying to get other things done is a good way for people that didn't know or like weren't aware of, I guess, the risk factors to find out that information. And so we offer free routine HIV screening for anyone that walks in. It's one of the questions that they ask in the intake rooms where they do the triage. They'll say, do you want to be tested for HIV? Yes, no. And so if no one takes blood from that patient, we will go do the point of care oral swab. And so when someone tests positive, if they were to test positive, we would do the linkage to care with either the Harriet Lane Clinic or Bartlett Clinic is usually where we send people. And so we find a lot of new positives or known positives that are currently not receiving care. And so what we're trying to do basically is identify patients at risk and get them started on PrEP or PEP. And so the volunteers will watch the ED track board, which is in Epic, and look for people who have consented to test or people that have any risk factors that we want to just reach out and talk to them about it. And then we do the point of care test, wait 20 minutes, give the results, and do the documentation. And so while we don't really do community activities, our community purpose is to have that linkage to care and identify people that don't know that they have HIV or connect them to get the treatment for it. And it's increased antiretroviral use in our area. And so the student learning outcomes are introduction to research in healthcare, because the HIV testing in the emergency department is part of the HIV research that's done. And so the impact on our partner is that they have more time to focus on gathering the data and doing the follow-up with patients while we're doing the point of care testing. And we learned a lot about how to counsel patients and just kind of ask those really uncomfortable questions and make sure that people that are in the emergency department that didn't think that they were going to end up talking about that figure out what are their risks, how can we mitigate it, and if they do have risks, getting started on PrEP.
Great. Thanks, Heather. Judges, any questions for Heather? Okay. Moving on, House of Ruth, Maryland. Leah and Alexis were both at House of Ruth, Maryland.
Hi, everyone. So we were at House of Ruth, Maryland. It was established in 1977, as it says on the slide. Basically, they provide shelter to survivors of intimate partner violence and their children. They have three main types of shelter that they provide. There's crisis, which they call the hotel. That's just for a few nights at most. They have short-term, which is like 30 to 90-day periods, and then long-term, that could be 6 months, a year, or 2 years. While they're on site, they have access to a wide variety of services to help them, including housing services, counseling, and the health suite. So we worked with the nurses within the health suite. Okay, so some of our student learning outcomes, I personally was on site a lot more than Leah, so I got to work with the public health nurses in the health suite. So I got to learn a lot from this patient population and a lot of their experiences and the resilience, and to see what a public health nurse does, which was really exciting for me because it exposed me to this whole new sphere of nursing.
And then for me, something I was really excited about was working with the kids at the shelter and also just discovering more resources for this population, because at the time when we came in, they had a list of resources, but it wasn't very clear, that I'll talk about in just a second. And then to learn the roles of nurses outside of a hospital setting, because sometimes in our program, we only really see nurses in a hospital setting. So I wanted to see what it looked like in more of this role as well. You can go on. Okay. Oh, great. I won't give you access to that video, but that's basically just a video of the resource referrals that we put together. So like I said, when we came in, they had one giant list of resource referrals for the population, and that included different shelters for urgent care, dental visits, vision visits, things like that. But it was just really disorganized at the time. So what Alexis and I did was we created a big Excel doc. And in that Excel doc, we had different areas of care and then where they could go, what insurances were accepted, the transportation looked like from the shelter to that service as well. So that took up a big chunk of our time. There was a lot to go through for that. And then I also got to go on site and do some children's group education. So I taught a nutrition session and basically just went in and talked with the kids about what healthy eating looks like, what those options are for them. And then because we know that Baltimore is a food desert, talking about, okay, if you love fast food, what are some options when you eat fast food that are going to make a little bit of a healthier choice for you? If you love going to McDonald's, all the kids are really excited about that. So we talked about pulling items off the menu that would actually be more of a nutritious option for them.
Okay, and then when I was on site, basically I would just go in for the day and help with whatever they needed that day, and that varied widely. So it could be I just helped get a Band-Aid for someone that has a scrape. One day we made goodie bags for Valentine's Day for all of the residents. Something that I did every week was door knocks. So while the public health nurse was sort of going through everyone who had notes, I would go and knock on the doors of all the residents, say hello to them, ask them if they had any health concerns, let them know what hours we would be open. So yeah. You can go into the next slide.
Yeah, and then this ended up pretty much being our impact at the site. It did get cut a little bit short because of COVID-19 as well, but we were able to revise and update that list of resources and then help the staff out pretty much in just any way we could. That was something we did a lot, was just asking what they needed from us to make their life a little bit easier at that point in time as well. So that was kind of the impact we saw.
All right, great. Thank you both. Judges, any questions for Leah and Alexis?
Leah, you had mentioned that this was a really good opportunity for you to get out of the hospital setting. I guess my question is, would you recommend that for other students as well to kind of engage in this way?
I would say absolutely, because it gives you such a broader perspective of the patients that you're caring for, whether that's within a hospital or in the community. I think you just see different aspects of it when you're working with them in the community. And it just gave me a greater, I think, appreciation for what the role of a nurse is in general. So I would highly recommend it to others.
Great. Thank you both. Okay, so next up, Danielle was at Shepherd's Clinic at their Joy Wellness Center.
Yeah, hi. So I was at Shepherd's Clinic, specifically the Joy Wellness Center. But in general, Shepherd's Clinic provides free comprehensive health care for those who can't afford commercial insurance, and they also can't qualify for government assistance. These services can include medical, behavioral health, wellness services. They have a whole lot of things. It really depends on who comes to them as a volunteer to teach and to provide these services. The entire building runs off of donations and volunteers only. So there are 13 staff members, over 200 physicians, nurses, counselors, and other volunteers that help with the services for about 800 patients annually. I, like I said, specifically worked in the Joy Wellness Center, which offers complementary services that work in conjunction with any of the medical and behavioral care that these clients might get, or they might honestly just come for the Joy Wellness Center services only. Some of these services include weight management, diabetes management, yoga, massage, acupuncture. The nutrition classes are a really big deal there. They love those. Movement classes, like all different types of yoga classes, chair yoga for those who aren't as mobile as others and things like that. And then the big focus is on stress reduction. So they put a big emphasis on that in general all throughout kind of all the services. So all these programs and therapies are open to the community and designed specifically to create transformative, healthy, life-affirming changes, basically any positive impact that you can. And they focused highly on the prevention of chronic conditions and teaching Baltimore residents how to take good care of themselves and how to get that better sense of balance. So not just focusing on the fact that you have diabetes, but what can you do? A lot of the people who come for diabetes management also go to the nutrition classes and figure out how to, cook a certain way or anything like that. Some of them bring their kids. They get very, very involved. As you see on the bottom, the goal of Shepherd's Clinic is to address the issue of people living without insurance. So personally, my student learning outcomes was to assist people with diverse educational backgrounds, ages, and health status. We do get a good diverse population in the hospitals, but I feel like this one, I definitely saw a different population than I normally would have during clinicals, let's say. Also learning about making an impact on people's health outside of the hospital setting. Like the previous presentation said, we don't really get outside of the hospital very much, so it's definitely a completely different environment. And you can really see how it impacts them. This is definitely something I think I would do once I'm licensed, volunteering in something like Shepherd's Clinic. Because you definitely see how these residents were so dependent on the clinic, and it was their social aspect, it was their physical activity, it was a lot. So even days that we were still there but classes were canceled, you saw how upset they were, and they voiced it too. They had no problem doing that. And even even the elderly patients who took, let's say, chair yoga, that was one of the most popular classes. most of them walked out of that class wanting to know how to be trained to become a yoga instructor so that they can keep teaching and like spread what they've been learning. So it definitely had a huge impact on the residents, and like we could see that, which was really cool. Personally, my impact, we helped with organizational and clerical duties, especially patient intake, checking in, and helping out with classes. So like I said, everything's on volunteers. So if they're slow, if they don't have a lot of volunteers that day, it was mostly based on the work that I did, just because it's all hands on whoever's there. And then obviously the impact the people of Baltimore adopted the joy wellness lifestyle and everything like that. We saw that firsthand. So it was really great.
Great. Thanks, Danny. Judges, any questions?
Had a quick question. You mentioned that the patient population is different from what you see in the hospital. How would you say they're different?
I think also when I say that to it, mostly the conditions that they're coming with and things like that, and like they're not attached to tubes and wires and in a bed and stuff. They might not even be that mobile or walking in with a cane or struggling or whatever it is, but they want to be there. They're choosing to come in. It's very not, it's not that they're sick. It's just that they're trying to better their lives in some way. And you could see that because some of them took buses all over Baltimore just to get to there for an hour class. So.
Wonderful. Thank you. Okay. Last slide, but certainly not the least. Tatiana was working with Squashwise this year.
Hi there, I'm Tatiana. Yeah, I was working with the organization Squashwise. It's a little bit about it. It's a nonprofit youth development program, primarily focused on, engagement with Baltimore City public school students. I, for the most part, worked just the way scheduling was with the 8th grade class, which was awesome because there was that consistency there, and I was able to build great relationships with them. So the services that they offer are intensive academic tutoring, mentoring, health and fitness education, and coaching in the sport of squash. So I'm just going to say I know nothing about squash. I was not a part of that, but my role was being the middle school academic mentor. So in that role, I provided academic and social support to the middle school students. Again, mostly the 8th grade students, depending on which day. I served as a resource assistant in homework and tutoring, assisted in delivering the organized activities. So basically my day would be, the way that's set up is half the students will be at squash, then they'll come back and do academic activities and tutoring. So during that kind of half, I would help them with their homework, but then we would also do an organized activity, which included high school admission strategies in the fall, since all of them were kind of looking to get into different high schools of their choosing. Financial management, goal setting, squash strategy, again, wasn't my wheelhouse, but I definitely learned a lot from them. But yeah, and other nutritional activities. They had really healthy foods there for snacks. I know that a lot of the kids didn't really have food stability at home, so it was nice to have those available for them, especially because it was after school, kind of near dinner time, excuse me. And then I would mentor some students who were interested in healthcare opportunities. So they had a lot of questions for me there. I was really excited. I learned a lot, engaged with and recognized the challenges of middle school students in the community. Learned about human services delivery in the nonprofit setting, and practice rapport building and educating, the young participants. So basically, I was excited because after school programs and sports were a huge part of my life. That kind of taught me a lot of lessons, like goal setting, teamwork, and just overall like time management. There's a lot of great life lessons. So I was really excited to kind of impart that kind of wisdom that I learned to them. A huge thing that I guess impacted me was the fact that I had a great time encouraging peer teaching, honestly more than I actually tutored them, because I found that some students were, getting 8th grade math a little better than I was. I caught on, but I know that it was great to just see them engage with each other. And if someone was struggling in English, and I knew someone who was great at proofreading, I would try to match them up and kind of just facilitate that learning. So it was a lot of just, encouragement, academic tutoring, and then also delivering those other programs that Squashwise, organizes. So it was a really great experience. Unfortunately, it was cut short with COVID. I didn't have any remote opportunities since it is an after-school program, but overall it was really great.
Wonderful. Thanks, Tatiana. Judges, any questions for Tatiana? Okay, I'm going to stop sharing my screen there and get back to our Brady Bunch view. So this was wonderful. I'm glad that we were able to still come together and do a virtual poster session. Of course, I want to thank each and every single one of you for the work that you've been doing throughout the year. I also want to thank our judges, Phyllis, Megan, and Ezat. Thank you all so much for joining and taking note, as well as the rest of the SOURCE team, as well as the Center for Community Innovation and Scholarship. It's a mouthful. A couple of just closing remarks, or these reminders for COP folks. A lot of you are not able to work remotely, and we know that. And that means some of you are likely not going to be able to extend your time while we're in this COVID crisis right now. You're going to be hearing from Emily and I pretty soon, because we will be doing, for most of you, the end of the program wrap up, which means that there's a final evaluation that you do. This is really critical information for us to get back about your sites and working with your preceptors. It also is information that we use for the following year when other students are coming into COP. So we do ask that you complete that when you receive it. And we'll have a little bit more information probably next week or so about a few of you that are still working that had requested to potentially work beyond our early May work study program. And there's some more information that's coming as we get some other details for those of you that are unable to work remotely, some other opportunities that could become available. I also wanted to acknowledge Emily for all of her work as the program assistant this year. Emily's going to be graduating soon. Congrats, Emily. But that also means that next year, if folks are around for all of next year, we'll be looking for a new COP program assistant. And I have always had the wonderful opportunity of working with somebody that actually did COP the year prior that becomes the program assistant for next year. So this becomes a job opportunity for those of you that are still around. Let me know. I can send out more details. But if you're interested, certainly ask Emily. She'd be happy to tell you more about it. But I'm also happy to tell you some more about it as well. And I just wanted to say thank you all so much for making this happen virtually and still doing your posters and working with us throughout some uncertainty that was going on with your sites, as organizations were still trying to figure out how they may or may not, as in case some of you be able to have remote opportunities. Any other final things that folks wanted to add or share before we end today's session?
Yeah, Mindy, this is Phyllis Sharps. As you do the end of program evaluation, can you identify students that may want to continue longer and possibly into the summer? There's potentially a new opportunity coming up that the School of Nursing will be involved in that I think you can do it virtually, but I think some of the COP students may be interested, and we certainly would continue paying them through the time frame.
We sure can. We can add that in that survey. And if anybody in the meantime, just let Emily and I know so we can kind of keep it all together at once. Thank you, Dr. Sharps. Great. Well, certainly not how I thought we'd be ending our last session, but nonetheless, it's wonderful to see all of your faces and hear from you about your experiences. So I just want to say thank you so much, and it's been an absolute pleasure working with all of you. Be well, be in touch with us, and thanks for coming. Have a good one. Bye, everybody.
Thanks, everyone.
Thank you.
Thanks, everyone.
Bye, everybody.